just not or try not to do it. Put it so.
Great. Thank you. So we've got about 7 minutes or so left. So I'm going to give the audience an opportunity to just ask a couple of quick questions of you. So Joe W., please state where you're from and briefly ask your question.
Dr. Esselstyn, the Flexner Report is historically referred to that Rockefeller medicine basically got rid of alternative health way back in the early 1900s and was the purpose for, or the source for drugs. Is that something that you've discussed with medical professionals and your colleagues, the impact of the Flexner Report?
I know the Flexner Report. I really got into the history because of the confusion that existed at the time for me. I spent a year at Oxford University and actually got back into the history of medicine quite thoroughly, all the way back into the 1800s, even late 1700s. The Flexner Report was key. You're quite right. It was very significant. But it was actually, it was a structure, if you will, a structured way of thinking about health and medicine in terms of one thing at a time. As I've mentioned several times, it's one cause, one mechanism by which it works, one disease outcome. And that's it. That's a business model. That's a business model because it gives an opportunity. In fact, it requires, in many cases, it requires something to be patented. That is a business of business. So medicine as a practice became a business primarily. And I have strong opinions about that. I wrote quite a paper on it at the time, the history of this field. And that's when vitamins, so-called vitamins, were discovered, not really vitamins. And it led to this whole notion that I now these days call reductionism. So the Flexner Report was very instrumental. You're absolutely right. And it was very significant and honored, by a lot of people. But I don't agree with it in principle, especially because it was English at the time. They were very much involved in this at Oxford University, where I was, and I met some folks that we talked about that back and forth, and don't care for it.
So there's a lot of stuff online about the history of medicine, and like the Rockefellers taking over and blocking all of the other, blocking all the other modalities of health. Is in your study of the history of medicine, is that something true? It sounds very conspiratorial, but a lot of things that sound overwhelmingly conspiratorial turn out to be factually correct. What's your thoughts on that?
Yeah, there's a lot of effort made behind the scenes to shape public opinion, to start with. And so the idea of focusing on one thing at a time, and especially if it's patented, that becomes a big thing. That's why they control the media. And so it becomes a discipline unto itself. And they don't want to hear anything like what I say, like all the nutrients working together as food, because people can do that for themselves. They don't need to buy all the drugs, and they can live longer. They can get the benefit. And so I would argue that even going back to the Flexner Report, or covering what you just said, that there's just focus on one thing at a time. It's been really a serious nemesis in this whole arena of human health, and a much more natural. I'd like to use the word Mother Nature, because nature, once you get to understand, how these things happen in nature the way they do, infinitely complex. Not the human mind can't comprehend those things, and all that comprehensive. But there's certain ways to kind of get a survey of all of it. That's where the business is, and so I'm kind of having a difficult time with really understanding what the medical system really did, why they did it. They started this way back in the middle 1800s. It came at about the time of all things. It turns out I was reading one book there in 1843, I think it was. This gentleman was a physician, a surgeon, fairly well known, and anyhow, he talked about the nature of, it's called constitutional nature of disease. Constitutional nature of disease, which I was kind of coming into my mind too. That's wholeness. That's the word that's the word whole. And I read that book in the Oxford Library, and I was just stunned by it almost. I felt like, I felt almost it was my book in a sense. And I
Really?
told my wife about it, and I said, this book, and then I looked back to see who the author was, and his name was George McElwain. My father's middle name is McElwain. He is my great grandfather. I didn't know it. Although ancestry, I've gotten involved in ancestry and they can't prove it. It's either George McElwain or his brother. In fact, I will show you. That's on the screen.
So just to be clear, so you did a body of work that you had your own trajectory. There was no family lineage of
Right.
this. Quite to the contrary, you were basically all about animal protein growing up.
Right.
And then you find out that you basically replicated your own great-grandfather's work.
Right there. He had 14 books. This is the book, one of the books. And then this is my grandmother's father. And that's what the family, they can't absolutely, ancestry can't exactly prove it. It's either her father or her uncle. So we're not sure of that. But it turned out that my father, when I was young, I went and told my mother. She said, "Can't you remember your father always talking about him?" Well, I didn't remember. So for me, it was totally accidental. My father was an immigrant from Northern Ireland. And so we learned about this from talking to his cousins.
Wow.
My father only had about 2 years of elementary school education when he came here. That's all he had. And so that's part of my story. He actually found out a way for me to go to a high school. I had to drive 102 miles a day, not to go to the rural country high school, but one in Washington, D.C. And I did that for 5 years. So he really had a fantastic influence on me, and he just wanted me to get the education he didn't have. And it turns out his middle name is McElwain. And our youngest son, who wrote the China study with me, is named after my father, McElwain, and this is George McElwain.
Wow. Well, that concludes our time. So thank you so much. Always extremely enlightening. So I really appreciate the presentation as well as all of your candid answers. So if we could unmute the audience so they can share their appreciation.
Thank you. Love you. Thank you so much. Thank you so much.
Thank you.
Thank you.